Mental health is a major crisis we're facing in the UK at the moment. And so, really, on the back of it, it's no surprise that we have seen a number of MMI interview questions come up in the past few years. And I anticipate this to continue really over the next few years. So, it's worthwhile spending a bit of time reading around it, understanding it, relating to it, reflecting on it, and think about a few different scenarios how you might respond to and around mental health if it should come up in your MMI interviews. So let's just discuss mental health briefly, shall we? I mean, one of the things to understand is about mental health is that sadly it's overlooked. Sadly, it doesn't get the attention it really deserves, in my opinion, and in the opinion of many, many people around the UK working in healthcare and in government. It beggars belief, in my opinion, why mental health gets overlooked so much. Is it because of its complexities? Is it because it's not difficult? Do you know what I mean? It's not as easy to address, I guess, as opposed to, let's say, replace a hip. Hip done, hip out. But mental health is an ongoing thing. It's a regular, ongoing. How do you completely get rid of it? So I guess these things it doesn't make it easy to bean count it and resolve it. To be fair. And it's so different, I find, between people. It's a unique, it's bespoke concept for different people. It affects people in different ways. So I guess from that perspective, it's not easy to tackle. But we need to tackle it. We need to deal with it properly as a nation. And you and I play a big part, both as medics and dentists. From a defining point of view, mental health, I suppose you could say it encompasses your emotional health, your psychological health, your social well-being as well. It's how you're feeling on a day-to-day basis. And it also affects how you handle stress, how you relate to others, and very, very importantly, how you make decisions. You need to understand that mental health isn't just the absence of it, it's also the presence of it. This is really, really key to understanding mental health. It's about coping with challenges, working more productively. It's making meaningful decisions around relationships as well. In the UK, mental health is a major issue, and it is statistically believed that something like 25% of people are affected by mental health in a meaningful way, whether that means medication or not. Because remember, a lot of mental health can be managed around talking therapies and supportive therapies. It's not just about medicating somebody or sectioning somebody. So it's very important to understand it from that perspective. It can affect a quarter of the population in the UK, and it's very prevalent among young people as well. It's estimated that 1 in 6 young people between the ages of 5 and 16 have some form of a mental health condition. And it's a very, very poorly managed. If you think it's badly managed amongst adults, it's actually worse amongst young people. Mental health provision for young people is not well served in the UK. In the past decade, we've seen a 50% increase in mental health. Why is that? Well, it's multifactorial, I suppose. It's the COVID pandemic's been a major driver. Isolation, loss of confidence, loss of family members, loss of work, the depression, recession, economic crisis. All of these things play a part in why post-pandemic we're seeing such an explosion of mental health issues. If you look at community factors, for example, economic inequality has increased considerably in the UK. Does that play a part in contributing to poor mental health? Isolation, whether it's from work, whether it's from family, whether it's for many reasons, we're seeing a lot more people who live in isolation, and that doesn't help their mental health situation as well. We've got cultural stigma that plays a big part. People from different countries, different backgrounds, different cultures and religions interpret mental health in a different way. Some manage it better than others for various reasons. And as healthcare professionals, we need to be able to navigate those nuances, those differences in approaches around mental health and health, the patient health education around those issues. It doesn't help at all by underfunding around the issue. Underfunding in general in the NHS, but we know that only about 11% of the NHS budget is spent around mental health services, and that is compounded by the fact that staff shortages is a major problem in mental health services. If we think it's not so good within the NHS in general, it's actually worse in mental health in terms of recruiting and retaining mental health nurses, psychiatrists, and so forth, and other professions that are affected by such as dentistry. You name it, every other speciality within the NHS is affected by people having poor mental health. So you should ask yourself, how does it affect me? Very importantly, as a prospective dentist, how is it going to affect you as a future dentist? I don't think you need to know so much. You don't need to be an expert clinician in the different conditions such as anxiety, depression, PTSD, and so forth. But I think a bit of knowledge around the topics is good. Presume if you were to talk about it, it might come across well if you understand anxiety, depression, things like that well. Also, if you think about how we're addressing it, that would be useful. So if you look at the investment the government has promised, around 2.3 billion, I believe, in the past 2 years. If you look at the early intervention programs, crisis helplines, workforce expansion programs, I think knowledge around those, how it impacts, how it doesn't, what are the pros and cons around those issues might be useful. In terms of managing and discussing mental health in interviews, make sure, around role plays and discussion, you talk about empathy. It's such an important issue. I've actually done a video separately within my online course about empathy. Really understand empathy. In my opinion, it's key. It's the key skill around being an effective doctor and a dentist. But when it comes to managing mental health issues in your patients, it is even more important to deploy empathy in the right way. Understand key policies as well, such as the NHS long-term plan and subsections around mental health. Think about ethics as well. How does mental health affect autonomy, decision-making capacity, and so forth? When can somebody make a decision or not? When can they not make a decision? Very, very important for you to navigate that in your interviews. And also think about, when you talk about populations, try and talk about diversity. Show your awareness around cultural diversity, social diversity, ethnic diversity, and so forth. I've seen loads of questions coming from the medical and dental school interviews, like, for example, why is mental health so important around public health issues in the UK? Why and how does mental health affect dental patients? How would you approach patients who are reluctant to discuss their mental health? How would you, look at the role of schools and universities in helping to manage and address mental health among students and staff, for that matter? What do you think of the UK's, mental health services? Are they adequately funded or not? So these are actual questions I've come across, and there's loads more. You can access those in my online course as well. So yeah, do spend some time on this topic. I hope this has been useful for you. Thank you very much.